Hello, and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen BLAIKLOCK. In this episode, our focus is heart disease. Heart disease is the #1 killer of men and women in the United States. And joining me to address this important topic is Dr. Challappa. And he is here. He's a cardiologist here in Elizabethtown. And we're going to start, I think, a little bit with maybe a definition of actually coronary artery disease, or you hear that term a lot. What does that actually mean?
Coronary arteries are arteries that supply the heart. And any problem that causes the oxygenation or the blood supply to the heart to be reduced causes coronary artery disease. The commonest cause is plaque buildup in the arteries. And this is secondary to buildup of fat, in a layman's term, in the arteries. It can also be due to other reasons, such as spasm of the arteries. So these are the two common causes of coronary artery disease.
So is coronary artery disease and heart disease kind of synonymous together?
We use it synonymously, but heart disease is more of a general term for any heart problems. Coronary artery disease specifically for diseases of the coronary arteries.
Excellent. Now, when we talk about heart disease, I know there are specific maybe signs or symptoms that an individual might exhibit to lead them to talk to their physician about heart disease and maybe their risk factors that they have in their family.
Right. And today we are probably using heart disease synonymous with coronary artery disease. So we're going to talk about coronary artery disease. The commonest symptom of coronary artery disease is chest pain, as we all know. And when it occurs with exertion, it goes more in favor of coronary artery disease. Our patients could have shortness of breath on exertion. Occasionally they have fainting spells, and sometimes they have palpitations. So these are the common symptoms of heart disease.
Now, individuals that might be exhibiting this, what is the common age bracket? This is the buildup, I heard you say, of the plaque in the arteries. So generally, we're not looking at individuals that might be 20 years old, or are we looking at middle-aged to adult?
There is no, I wouldn't put it as, you probably wouldn't see it in a very young adult. But I would say anywhere from 30 and older, you would see coronary artery disease. But that doesn't mean that a 25-year-old could not have coronary artery disease, because if he has genetic predisposition to coronary artery disease, you would see a 25-year-old. We rarely hear of 25-year-olds having a heart attack. And this is rare, but it can happen.
And I think, and the reason I brought that up is because you talked about the buildup. So basically what we do every day, our lifestyle, right? What we're eating, maybe exercising, and then maybe the family history. This is the buildup over a period of time to put you, again, then at risk for coronary artery disease, correct?
Exactly right. And it starts at a very young age, even at your teenage years, and slowly starts building up over a number of years. So what we eat, our lifestyle, and blood pressure, and sugar diabetes could be some of the risk factors that can make this worse.
So let's talk about what we need to do as far as prevention tips for our viewers, because we really need to take responsibility, right, and take care of ourselves.
Absolutely.
And so heart disease, we've mentioned that it's actually the #1 cause of death for both men and women.
Right.
So that affects generally all of us.
Exactly.
And we need to make sure we're being healthy. So when we talk about diet, what are maybe some nutrition tips for our viewers so that they can learn to eat maybe heart healthy?
What viewers need to understand is eat a healthy, nutritious meal, which is low in saturated fats. And saturated fats, examples are things like butter, margarine, red meat with a lot of fat in it, bacon. These are all saturated fat. To eat a lot of vegetables and fruits and substitute red meat with lean meat and things such as fish, salmon, and chicken, which is high in omega acids, which help the heart. Also, nuts and olives also help this because they also have unsaturated fats.
And I've heard too, maybe changing even like dietary, or excuse me, not dietary, but dairy products, I should say, maybe from the higher fat content down to 2% or half.
Exactly
correct?
right. So when I said saturated fat, that includes anything that has saturated fat in it. Reducing it from 8% milk to skim milk or 1% milk helps a lot.
Absolutely.
And that is diet. Now the other things that the viewers need to know is exercise, extremely important. And exercise, even about 30 minutes a day, is helps reduce the risk of heart disease. And watch your salt in your diet. Make sure you have a low salt diet. And and last of all, the other dietary thing is you have to make sure you watch your carbohydrates, because diabetes is a major risk factor for heart disease.
So we want our individuals to eat healthy, of course, to make sure that you're exercising, and those are two things that we can do ourselves. Those are
Exactly.
lifestyle habits that we can learn. What about smoking?
Smoking is one of the foremost preventable causes of heart disease. It has been shown that people who smoke have 2 to 4 times the risk of a heart attack than a normal person who does not smoke. Now, once you quit smoking, the risk of heart disease, heart attack reduces by about 36%. And this has been shown in various studies. The amount of cigarettes and the number of years you have smoked also has an impact on heart disease.
But it's not too late to ever quit,
It
correct?
is never too late to quit. The beauty of heart disease and smoking is the effects are pretty immediate. And once you quit smoking, in the next few months, your risks start decreasing considerably.
So very important. If you obviously are someone who might be smoking, we know it is an addiction. It's very hard, to stop.
Exactly.
But there are medications to talk to your physician about. There's lots of resources out there on the website. We'll give some of those resources at the end, and then maybe even looking into a smoking cessation class where you get a buddy in that support system to do it too.
Absolutely. Any way you can do it, you got to attempt to do it. It is one of the most important preventable causes.
So we've talked about making sure that we are eating healthy, we're exercising. If we smoke, looking at our options for quitting and getting some assistance in doing that. What can we do as far as our genetic background? What puts us at risk if we have maybe a mother or a father that might have had heart disease? Does that put us at greater risk?
Family history of heart disease is again one of the important risk factors for heart disease. And when you have a family history, especially when it's at a very young age, it is very important to change your lifestyle. And keep a watch, just like we talked about on your diet. Make sure you keep your cholesterol low as much as possible. Don't smoke. Keep your blood pressure within normal limits, and make sure you're not a diabetic, because already you're at risk with a strong family history, and it is very important that you reduce the other risk factors.
Now, I've heard you say blood pressure. So we have heard a term kind of knowing your numbers. So there's probably some numbers some individuals need to know, like what their blood pressure is, their cholesterol maybe. Are there some screenings and some tests that they need to do to make sure that they know kind of internally what's going on and how healthy they are?
Yes. Especially when you start having some risk factors, like a family history, like you mentioned. It is very important you go to see your primary doctor and get some basic things done. At least get a cholesterol check. And we want anyone with a strong family history to have their bad cholesterol as low as possible, which is recommended to be less than 70. And then we want your good cholesterol to be as high as possible, and which is more than 45. And then you want the triglycerides to be normal. Similarly, with your blood pressure, there's been a push to keep your blood pressure at 120/80. And whether you do it with diet or whether you do it with medicines, both cholesterol and blood pressure, you need to keep it within normal limits.
So those are good points, absolutely. And I have heard something that starting at age 20, that's kind of the recommendation, they should be getting their cholesterol checked every 5 years. I mean, you should know what your numbers are. Is that pretty much a good rule of thumb?
Since we talked about that atherosclerosis starts at a very young age, and if you start checking your cholesterol at the age of 20, and you know that your cholesterol is high, you probably can start off with a dietary modification and bring your cholesterol down. People feared getting the cholesterol checked because they think the cholesterol is going to be high and they're going to be on medications. But majority of the young people can get their cholesterol down just by modification of diet and exercise.
So we want to make sure that cholesterol level that you're checking actually, as you were saying, the word atherosclerosis, that's that big happy word about the plaque buildup, right, in your coronary artery. So you want to really make sure that you know your numbers as far as your cholesterol level, your blood pressure, I heard you mention. What about our risk for diabetes? What tests do we have for that?
Normally there are two tests. One, we just do a fasting blood sugar. And the majority of the time we want it less than 100. And if we see that your blood sugar is slightly high, you keep a watch on it. So the moment you see that your blood sugar is more than 100, you want to make sure that you cut down on your carbohydrates and sugars and recheck it in 3 to 6 months and see if it's persistently high.
Good point too. And then what about our weight? We love to get on that scale. Should we know how much we weigh?
Obesity is one of the another modifiable risk factors for heart disease. Now, as we know, we're becoming a more obese country. 60% of the country is obese. And it is very important that we need to check our weight and height. And any of this, either in your doctor's office or even in your stores, will give you the approximate height and weight correlation. You need to be as close as possible to that. And to reduce weight, it's very important to follow not only a dietary regimen, but also an exercise regimen.
Absolutely. And the numbers with the height and the weight are your body mass index.
Exactly right.
So you can find that out by going to several websites. I know our hospital website, www.hmh.net, clicking on Health Link, you can find out some of your personal risk factors there. The CDC, Center for Disease Control, has several of those, and also the American Heart Association too. But those are definite numbers that you want to know. Obviously your blood pressure, your cholesterol levels we've been talking about, your blood sugar level or blood glucose we've heard too, your weight. These are important things that we need to know about ourselves, and then we can take action as far as our lifestyle risk factors and making some of those modifications.